Everyone, welcome to exercise therapy class. So we were discussing about the techniques of MMT, and today we'll discuss for wrist and hand muscles. So first, let's look into flexor pollicis brevis. The function of this muscle is, as you can see in the name, it is flexion of the thumb. So the origin insertion we should be knowing, and we already know from anatomy that flexor pollicis brevis originate from the carpal bones and get inserted to the proximal phalanx of the thumb. You can refer to the first picture here, especially the joint which it flexes is metacarpophalangeal joint of the thumb and also the carpometacarpal joint. So, what should be the position of the patient for examining muscle strength for flexor pollicis brevis? The position of the patient should be sitting or supine, and the examiner stabilizes the hand. You can see in the second picture, one hand of the examiner stabilizes and other hand is used for resistance. So here again, I would like to add a point here that um, against the gravity or elimination of gravity is not important for the small muscles because it has no significant effect by the gravity on this small bones. So therefore we will be assessing directly for grade 4 and 5. If the patient is able to perform full range of motion of the joint, then we'll jump into grade 4 and 5. So here we'll ask the patient to perform flexion of the metacarpophalangeal joint of the thumb without flexion of the interphalangeal joint. So that will be the task given to the patient for flexor pollicis brevis. And if patient is able to perform full range of flexion of the metacarpophalangeal joint of the thumb, then we'll jump into grade 4 and 5 by applying the resistance. So the resistance you can see in the second picture, it has been applied to the proximal phalanx of the thumb. So you can think this way: wherever the muscle is inserted, that particular bone, that distal part of the joint should be resisted. So the resistance would be against the palmar surface of the proximal phalanx in the direction of extension, because the function of the muscle is flexion of the thumb, so our resistance would be towards extension. So let's move on to the video demonstration and view how we can assess MMT for flexor pollicis brevis. So we'll ask the patient to perform flexion of the thumb, and if patient is able to perform full range, then we'll jump into grade 4 and 5. So first patient performs flexion of the thumb, and then we'll apply the resistance on the palmar aspect of the distal phalanx of the thumb and ask the patient to perform flexion. So this would be graded as grade 4 or 5 depending upon the amount of resistance applied. Now let's move on to abductor pollicis brevis. Let's know what is the function. It is abduction of the thumb. So the patient position is similar to the previous muscle. It is sitting and supine, and the examiner stabilizes the hand. You can see in the second picture how the hand is being stabilized. And then after that, we'll ask the patient to perform abduction of the thumb. If patient is able to perform full range, then we'll jump to grade 4 and 5 by applying the resistance. So what should be the direction of the resistance and where should we apply it? It will be applied again against the proximal phalanx because that is the insertion part of the abductor pollicis brevis, and the direction of the resistance should be towards the palm, that is towards adduction. So here you can see the video. We'll ask the patient to perform abduction of the thumb and then we'll resist it to see if the grade is grade 4 or 5. Next muscle we would like to discuss is opponens pollicis. So the function of the muscle is opponens, that is slight abduction, flexion and medial rotation of the metacarpal bone. So what should be the position of the patient? Again, similar position, sitting and supine, sitting or supine, and examiner stabilizes the hand as shown in the second picture here, and then we'll ask the patient to perform opponents. Patient will perform flexion, abduction, and slight medial rotation of the metacarpal bone so that the thumbnail shows in the palmar view. Then, if patient is able to perform this function, we will resist the function and check if it is grade 4 or 5. So the resistance would be against the metacarpal bone because the opponent's pollicis insertion is in the metacarpal bone. And then our direction of resistance would be towards extension, adduction, and lateral rotation, which is just opposite to the action of the muscle. So this is the function of opponent's pollicis, and then we'll restrict the function by applying resistance against the motion, that is towards extension, adduction, and lateral rotation. So we move on to other muscles, that is extensor pollicis longus. Again, the name suggests extensor means extension, pollicis means the thumb, and longus means the muscle has longer length. The patient position should be sitting or supine, and uh, per, the action that the patient has to perform is the function of the muscle, that is extension of the interphalangeal joint of the thumb. So before applying pressure, we have to give the counter pressure to the proximal phalanx and the metacarpal bone of the thumb, and then with other arm we will apply the resistance against the dorsal surface of the interphalangeal joint of the thumb. We have to apply the resistance in the direction of flexion, where the function of the muscle is extension. So we'll see the video demonstration here. With one hand, the hand is supported and as well as given the counter pressure to the proximal phalanx and the metacarpal bone with the thumb, and we'll ask the patient to perform extension. Once the patient has performed extension, we will apply the resistance on the interphalangeal joint of the thumb. We have only one interphalangeal joint at the thumb because it has only two phalanges. Next muscle we would like to view is flexor digitorum superficialis. So the function of the muscle is again flexion of the fingers. Its insertion is at the middle phalanx. For index fingers we have three, for middle ring and the little finger we have three phalanges. So this muscle gets inserted to the middle phalanx. So the position of the patient should be sitting or supine. Here, the examiner stabilizes the metacarpophalangeal joint with the wrist in neutral position or slight extension. And then with other hand we will apply the resistance, and before applying the resistance we'll ask the patient to perform flexion of the proximal interphalangeal joint because it has no action on the distal interphalangeal joint. So therefore distal interphalangeal joint should be extended. And once the patient performs flexion of the proximal interphalangeal joint, we will apply the resistance. So the application of the resistance should be at the palmar surface of the middle phalanx because the insertion is in the middle phalanx. And the direction of the resistance should be towards extension of the proximal interphalangeal joint. So once we have completed one finger, if we have completed index finger, then we'll move on to middle finger, then ring finger and little finger, because we have four bands of the flexor digitorum superficialis inserting at these four fingers. So let's check the video demonstration. We'll stabilize the metacarpophalangeal joint with one hand, and with other hand we'll apply the resistance. Before applying the resistance we'll ask the patient to perform flexion at the proximal interphalangeal joint. Then we'll apply the resistance at the middle phalanx and ask the patient to perform full range of motion. Then we'll start testing for other fingers. The next muscle is flexor digitorum profundus. So, what is the difference between flexor digitorum superficialis insertion and flexor digitorum profundus? Flexor digitorum profundus also splits into four bands, and then it gets inserted to the base of the distal phalanx. So it has a function for proximal interphalangeal joint as well as distal interphalangeal joint. The position of the patient should be sitting or supine. Again, we'll fix the wrist with the wrist in slight extension. The examiner stabilizes the proximal and middle phalanges. So we want to see the action of this muscle at the distal interphalangeal joint. So therefore, we'll ask the patient to perform flexion of the distal interphalangeal joint, and then once the patient performs full range of motion without any resistance, we'll move on to applying resistance, that is minimum or maximum resistance. So the resistance is applied against the palmar surface of the distal phalanx in the direction of extension. So it is similar to the flexor digitorum superficialis, but the area of application of resistance differs and the stabilization of the proximal part also differs here. So you can see in the video demonstration, we will stabilize the middle phalanx as well as the proximal phalanx of the finger, and then we'll ask the patient to perform flexion of the distal interphalangeal joint, and we'll apply the resistance and ask the patient to perform flexion of the distal interphalangeal joint. Moving on to next muscle, that is flexor carpi radialis. So what is the function of flexor carpi radialis? Flexion of the wrist and radial deviation. So the position of the patient should be sitting or supine, where the forearm is in slightly less than full supination, and it is supported by the examiner, as you can see in the second picture. Then we'll ask the patient to perform the function of the muscle, that is flexion of the wrist towards radial deviation. If the patient is able to perform full range, we'll apply the resistance, that is against the thenar eminence in the direction of the extension towards the ulnar side, as you can see in the picture. So we'll stabilize the forearm, and then we will ask the patient to perform flexion and radial deviation and apply the resistance against that movement and check if it is grade 4 or 5. So next muscle is flexor carpi ulnaris. Here the function is flexion of the wrist and ulnar deviation. So just the position of the patient remains the same, sitting and supine, but forearm has to be in full supination, and we'll ask the patient to perform flexion and ulnar deviation, and the resistance will be applied at the hypothenar eminence in the direction of extension towards the radial side. So I don't have a video demonstration for this, but it is similar to flexor carpi radialis, but the direction of the function is different and the resistance applied is in the different direction compared to flexor carpi radialis. So here are some of the assignments that I would like you all to complete the assignment and submit, as these muscles are similar to what we discussed today. So I would like you all to explain the techniques of performing MMT for the following muscles, that is adductor pollicis, hypothenar eminence, flexor pollicis longus, extensor pollicis brevis, palmaris longus, extensor digitorum, extensor carpi radialis longus and brevis, and extensor carpi ulnaris. Thank you.